So I'm doing postpartum assessment, so I would knock on the patient's door. Hi, my name's Brooklyn. I'm going to be your nurse today. Can you tell me your name and date of birth?
Kenton Fleener, 11/18/98.
I would match what they say to their armband in the morning, and it matches, so we're good to go. So I would wash my hands and provide for privacy. I'm going to raise the patient's bed and apply some gloves. And I'm going to start out by checking. First, I would ask the patient if they needed to go to the bathroom. So when was the last time you urinated?
About 5 minutes ago.
Okay, so you don't need to go to the bathroom?
No.
Okay. So first I'm going to start by looking at the patient's breast. So I would remove their gown. I'm looking for engorgements or any tenderness, and if they're breastfeeding, I'm going to look for dry, cracked, or bleeding nipples. Hers are good, so then I would move down to the uterus, but first I'm going to listen to bowel sounds. And bowel sounds are present in all 4 quadrants. So now I'm going to palpate the uterus. So I'm going to stabilize the bottom of the uterus, and I'm going to find the fundus, and I'm going to massage it. And we want it to be firm. If it was not firm, then I would continue massaging it until it was. And we want this to be firm so they're not at risk for bleeding. And hers is firm, so we're good. So when was the last time that you had a bowel movement?
5 minutes ago.
Okay, and are you passing gas, going to the bathroom normally?
Yep.
Okay, so now I'm going to ask you to roll onto your side. I would pull the patient's gown up, and if they had underwear on, I would pull that down at this time. So I'm checking for hemorrhoids, lochia, and looking at their episiotomy. So this patient does not have any hemorrhoids. Their episiotomy looks good, and their bleeding is okay because they have not saturated a pad within 1 hour, and I don't notice any large blood clots or anything. So now you can roll back over. I would make sure they had their gown and everything pulled back up. I would change my gloves, and I'm going to check their legs, their lower extremities. So I'm looking for signs of a blood clot or a DVT. So if one leg was swollen, red, tender, and the other one was not, that could be a sign. So I'm feeling of their pulses and just making sure that they look okay. And then I would go ahead and check her upper extremities too, just to be safe. And how are you bonding with your baby?
Great.
All right, and do you have any pain?
No.
Any questions or anything?
No.
All right, so I will lower the patient's bed and attach their collate, make sure they're covered up, they don't need anything, remove my gloves, wash my hands, provide for privacy, and document.